Good morning, everyone. We are Group 2 in charge for bag technique and urine testing. So the members are Gerard Chu, Willie Alosada, Jamel Garcia, Samantha Perpetua, Ariane Quijano, and Hannah Tumulak. So for the learning outcomes of bag technique, CLO1, define and discuss the terms related to bag technique. CLO2, to give importance of bag technique, nursing bag or public health nurse bag, and home visiting. CLO3, discuss the types of family nurse contact and the different types of caseload. CLO4, make a plan of visit based on the available data. CLO number 5, identify the contents of the CHN bag. CLO number 6, recognize the general guidelines in using the CHN bag. CLO number 7, explain the different principles in bag technique. CLO number 8, to demonstrate beginning skills in bag technique. CLO number 9, utilize the knowledge in bag technique in providing care to the client using clinical case scenarios. The learning outcomes for urine testing. CLO number 10, define terms related to urine testing. CLO number 11, discuss the importance of urine testing. CLO number 12, identify the factors influencing urination. CLO number 13, explain the principles involved in urine testing. CLO number 14, compare the characteristics of normal and abnormal urine and cite the possible causes of abnormalities. CLO number 15, identify the common urinary problems and causes. CLO number 16, explain different ways in specimen collection and tests. CLO number 17, state the different methods of urine testing. CLO number 18, enumerate the nursing responsibilities before, during, and after urine testing. CLO number 19, demonstrate beginning skills in urine testing. CLO number 20, utilize the knowledge in urine testing and provide care for the clients in clinical case scenarios.
Hi guys, I'm Samantha Christine Perpetua and I will be discussing CLO number 1 to 3. CLO number 1, define and discuss the terms related to bag technique. So first, bag technique. It is a tool by which during the visit of a nurse, she will be able to perform a nursing procedure with ease and deftness to save time and effort with the end view of rendering effective nursing care to clients. Plan a visit. It is an order of preparations or plans to accomplish when visiting a patient. It is an essential tool in achieving the best results in home visiting. Home visit. It is a visit made by a health professional to a patient's home, usually with face-to-face contact. Family nurse contact. It is within or behalf of the particular family and the nurse in achieving an important goal for the success of delivering nursing care. Community health bag. It is an essential equipment of the community health nurse which he or she has to carry along while conducting community visits. It contains basic articles which are necessary for giving nursing care at home situations or community settings. Lastly, caseload. It is a number and kind of families or cases handled at a given time. CLO number 2, importance of bag technique, nursing bag or public health nurse bag and home visiting. Importance of bag technique, to minimize if not to prevent the spread of infection, to work efficiently and rapidly during techniques, for organization purposes. Importance of community health bag, serves as a first aid kit, to work efficiently and swiftly during nursing procedures, to conserve time and energy, to minimize or prevent the spread of infection, to render effective nursing care to clients or members of the family during home visit. Importance of home visiting. It provides necessary healthcare activities, impart health teachings to the family for maintenance of health, to evaluate results of the outcomes of nursing care given, to know the health status of an individual or a family. CLO number 3, Types of family nurse contact and different types of caseloads. Types of family nurse contact. Home visit. It is a professional, purposeful interaction that occurs in the family's residence to focus on promoting, maintaining, or restoring the health of the family or its members. This is when a health caregiver visits a home in the community. Clinic visit. Clients inquire or to seek health care consultation, checkups, or treatments of health problems visit in a private clinic, health center, barangay health station, or in an ambulatory clinic during community outreach activity. School clinic visit. It is where students seek health care services from their schools. Most schools have clinics wherein the nurse is always in contact with the students who are prone to accidents. Telephone. The nurse can contact the client through the telephone if there currently is no way of reaching the client through visiting means. Group conference. It provides an opportunity for initial contact between the nurse and the target families of the community. It may take place at a health facility or in the community. Written communication. It is used to give a particular information to families, such as instructions given to parents through school children. Types of caseloads. First, morbidity. It is for the diagnosed or undiagnosed diseases. Second, antepartum case. It is for the pregnant woman. It is giving care of pregnant woman during the time in the maternity cycle that begins with conception and ends with the onset of labor. Third, postpartum case. This period is considered after the mother's delivery. This case is about the management of the mother, newborn, and infant during the postpartum period. Monitoring and management of patient who has given birth 6 months after. Fourth, health provision. It is a type of case which the visit is based on the needs and principles of the client. It is used for family, children, elderly, mothers, well and sick, and their recognized needs. Fifth, case finding. This is finding out viable illness of the patient and assessing the client. 6. Geriatric. This is for the olds, 65 years of age and above. 7. Mortality. This case is about the death rate of a specific illness in a certain population.
That provides you with basic characteristic about the client, a general objectives, which is what you expect to achieve in general terms, while the specific objectives break down the general objectives into smaller, logically connected parts that address the problem, and the nursing actions. So you'll be making 3 plan of visit. The first plan of visit is when you first arrive in the community. The second plan of visit is when there already has a presented case. The third plan of visit is the termination of contract. This is an example of a plan of visit. So we start off by having this format, the name of the family, the address, the date on when you had the community visit, and the type of caseload. So here is the general objectives, which is after 1 week of home visiting, the client as well as the family will be able to acquire knowledge, appropriate skills, and positive attitude in the promotion and maintenance of health and prevention of illness in the care of the family. For the specific objectives, after 30 to 45 minutes of student-nurse family interaction, the client will 1. Establish rapport with the client and family members. 2. Explain the importance of home visiting. 3. Recognize the advantages of home visiting. 4. Identify actual and potential problems in the family and formulate a family nursing care plan in collaboration with the members to resolve the identified problems. 5. Set contract for the next home visit. For the nursing actions, first you have to establish rapport with client and family members. In order to establish rapport, you have to introduce self to the client as a student nurse of Cebu Doctors University in a polite and respectful manner. B. Exemplify the core values of a CDUC and student. Letter C. Display appropriate behavior during the interaction. And D. State the name of each family member. 2. Explain the importance of home visit. So you have to define home visiting to the client's level of understanding. B. Recognize the advantages of a home visit. Number 3. Enumerate the advantages of the home visit. 4. Identify actual and potential problems in the family and formulate a nursing care. Conduct interview with the client. B. Utilize family assessment tools such as the Initial Database or IDB and the Family Coping Index or the FCI to identify potential and actual problems. Letter C. Generate collaborative answers from the client as to the possible solutions to the problems identified. Number 5. Set contract for the next home visit. So you have to agree on the next home visit as to the date, time, and place. The second plan of visit already has the presented case. So in here, the SOPI documentation will reflect. So we have the general objectives, which after 2 days of student-nurse family interaction, the family will be able to apply and manifest knowledge on good personal hygiene. Specific objectives: after 1 hour of student-nurse family interaction, the family would be able to 1. Define proper hygiene, 2. Gain knowledge about the importance of proper hygiene in the activities of daily living, enumerate at least 3 health problems that a poor hygiene could cause, 4. How to maintain proper hygiene, 5. Family can safely execute self-care activities to utmost capability. For the nursing action, 1. You have to assess the degree of awareness of the family with regards to the existing problem. Second is to discuss the importance of proper hygiene in their health. Third, you have to discuss the potential health problems that could arise if proper hygiene is not practiced properly. Fourth, teach the family on how to perform hygienic measures like hand washing, hair care, cutting nails, brushing of the teeth, taking a bath daily, coughing and sneezing hygiene, and toilet hygiene. Number 5, encourage the family to continue hygienic measures. The SOPI documentation consists of the subjective data, the objective data, the assessment, the plan, intervention, and the evaluation. For the subjective data, these are the complaints that the client tells the nurse. The client verbalizes, "Ang ako anak gahi kayo og ulo, dili maligo taga-adlaw kay bugnaw kuno ang tubig. Gabi ira sa jud mi mag-toothbrush para tipid toothpaste." For the objective data are data that can be seen or can be measured. The client eats with bare hands without hand washing. The client walks barefooted, has dirty nails and foul odor. Disorderly display of oneself with messy hair and dirty clothes. For the assessment, these are the conclusions that are based off the subjective and objective data shown or given by the patient. Poor hygiene of the family as health-related problem due to inability to maintain a good personal hygiene, which is conducive to health maintenance due to inadequate knowledge of importance of personal hygiene. P for plan. It is the strategy for relieving the patient's problem through nursing interventions. So after 8 hours of student-nurse family interaction, the family will be able to apply and show good personal hygiene. For the intervention, these are actions that a nurse perform in order to improve the comfort and overall health of their patients. So for the intervention, encourage the client to be informed and practice good hygienic measures to lessen irritation or infection. E for evaluation. This is the analysis on how the nursing intervention has kept the patient. This determines whether the interventions taken by the nurse is effective. For the evaluation, the client is able to practice hygienic measures independently. CLO number 5. Identify the contents of the CHN bag. Here is a picture of how a CHN bag looks like. The contents are rectal and oral thermometer, syringe and needles in a metal container, You need 3 cc's and 5 cc's for the immunizations. Test tube and test tube holder, this is for the Benedict's test. The medicine dropper is used for putting the Benedict solution to the test tube. In performing the Benedict's test for urine testing, you need matches and alcohol lamp with denatured alcohol in it. Medicine glass is used to measure for the Benedict's test. The baby scale is used to weigh in the baby, however you are not allowed to weigh the baby without a supervision of a healthcare professional or ACI. Next is betadine solution, spirit of ammonia. This is used to prevent or treat fainting, Lysol, Benedict solution for the Benedict's test, and denatured alcohol. We have kidney basin used for the delivery of placenta, and the Kelly straight, a Kelly curve, an umbilical cord clamp used to clamp the umbilical cord in place, and the cotton balls. A cotton applicator, a hand towel used to wipe the hands dry, and a soap dish with soap. An apron that protects the nurse's uniform, a sterile gauze, a sterile gloves that protects nurse from infection and to protect the patient also. We have sterile French catheter, which helps to drain urine from the bladder through the urethra. We have a paper waste bag or a waste receptacle, a small plastic bag. We have a 5x8 soap dish lining, a 14x20 paper lining, 13.5 by 19.5 plastic lining, and a 12.5 by 18.5 paper lining. This is used to protect the bag from getting wet and or contaminated. CL06 recognize the general guidelines in using the CHN bag. Perform hand washing as frequently as possible to minimize contamination of bag and its contents. This also prevents infection from the care provider to the client. The CHN bag should contain all the necessary articles and equipments which may be used to answer all emergency needs. Contents of bag should be protected from contact of different unsterilized objects to avoid contamination. The arrangement of contents of the bag should be the most convenient to the users to facilitate efficacy and so to avoid confusion. Avoid swaying and shaking the bag when carrying it. This might cause breakage of the things inside it. The CHN bag should be thoroughly cleaned and disinfected after using, especially if there is a communicable case in the area of your duty. This is to protect caregiver and prevent infection, and also to prevent contamination.
CLO number 7, explain the different principles in bag technique. The different principles in the bag technique include psychology, time and energy, microbiology, and sociology. So the first is psychology. This is to inform the patient what are the processes and techniques on what he or she is going to feel during the procedure. Informing the client on what's going to happen is going to ease them and let them be less anxious. Second is time and energy. So the nurse must be prepared on the specific equipment he or she is going to use for the procedure. The equipment must be fully working and prepared before the procedure. Microbiology, the materials that are used must be sterilized to avoid the spread of microorganisms. And last, we have sociology. This is to build trust with the patient and overall maintain good interaction with the client. This is so the client would cooperate with the given circumstances. The nurse must inform the client before carrying out any procedure.
Hello everyone, my name is Mr. Willie M. Alosada II and I'll be discussing about the following. First we have the definition of terms. So first we have urine testing, which is used to determine any abnormalities in the urine. And next we have enuresis, which is involuntary urination, especially by children at night. Then we have diuretics, which is medicine that stimulates flow of urine. Next we have ketone bodies, which are products of fast metabolism and appear in the urine. Next we have hematuria, which is discharge of urine containing blood. Lastly, we have uric acid, which is the end product of purine metabolism, and acid in the urine. Now I will be discussing about the importance of urine testing. First, we have to determine if there are any abnormalities in the urine. Then we have to monitor proper functioning of the liver and the kidney. Next, we have to help determine the client's hydration status. Then we have to determine the alkalinity or acidity of the urine. Lastly, we have to determine any disorder on the glucose metabolism.
Hi guys, my name is Jamel Oren Garcia and I will be reporting CLO number 12, 13, 14, and 15. For CLO number 12, identify the factors influencing urination. Number 1, growth and development. Infants and young children are unable to concentrate urine and reabsorb water effectively. In relation to their body size, infants and children excrete large volumes of urine. A child is unable to control micturition voluntarily until the age of 20 to 24 months. Number 2, socio-cultural. The habits of micturition are no exception. North Americans expect toilet facilities to be private, whereas Europeans accept less private communal facilities as a way of life. Personal habits. Some people follow complex routines before defecation. Usually, fewer rituals precede urination. Privacy is the most essential condition for most people. Muscle tone. Weakness of abdominal and pelvic floor muscle impair bladder contraction and control of the external sphincter. Medication. Various medications influence the volume of urine. Diuretics prevent the reabsorption of water and certain electrolytes in the kidney tubules, resulting in urine. Examples: levodopa causes urine discoloration. Chlorothiazide hydrochlorothiazide causes the kidneys to get rid of unneeded water and results from the body into the urine. Furosemide is a potent diuretic. In the kidneys, salt, water, and other small molecules normally are filtered out of the blood and into the tubules of the kidney. The filtered fluid ultimately becomes urine. Triamterene helps make more urine and to lose the extra water from your body. This medicine is used to treat high blood pressure and edema or swelling from excess water. Fluid intake. Increase in fluid intake equals increased urination. CLO number 13. Explain principles involved in urine testing. Anatomy. The urinary is hollow, muscular, and distensible organ that sits on the pelvic. Microbiology. The nurse must do the special precautions which are needed in the care of incontinent patients to avoid infection. Special precautions when handling urine samples is also important. Chemistry. The use of Benedict solution to determine the volume of sugar present in the urine. pH of the urine, which indicates the acid-based organic waste. Pharmacology. Diuretics are drugs that are used to decrease urine output. Physics. Specific gravity of urine is the relation it bears to the weight of water. Psychology. Frequent urination may be caused by excitement, anxiety, or fear. The client must be relaxed. Anxiety about urinating overstimulates the person's nervous system and clamps the sphincter shut. CLO number 14. Compare the characteristic of normal and abnormal urine and cite possible causes of abnormalities.
The urine formation overview. The first step is the glomerular filtration. This is the first step in making urine. Waters and solutes are forced into the capillary wall and the pores of the glomerular capsule into the renal tubule. So basically this means this is like the process of how your kidneys used to filter the excess fluid and waste products out of the blood into the urine collecting tubules of the kidney. Second, we have the reabsorption of substances from the renal tubule into the blood. So the ions will be reabsorbed back into the circulatory system and the fluid passes through the components of the nephron, which makes the waste and ions removed, and as the ion concentration changes. So basically what happens here is that the nephrons remove the water and solutes from the pre-urine and returns them to the circulating blood. Third is the secretion of substances from the blood in the renal tubules. During the secretion phase, substances like hydrogen, creatinine, and other drugs will be removed from the blood to the peritubular capillary network into the collecting duct. So the end product will be urine, which is the substance that were not reabsorbed.
For color, normal finding is pale, yellow, or to amber. Abnormal findings, darker than usual, you may be dehydrated. If it is pink or red, it indicates red blood cells within the urine or a sign of kidney damage and disease. Brown, severely dehydrated or liver disease. Orange, dehydrated, liver or bile duct condition or food dye. Blue or green, rare genetic disease, bacteria or medication or food dye. Cloudy, it can be a sign of UTI. The normal finding for the smell of urine is faint aromatic. Abnormal finding is sweet or fruity odor, indicative of diabetes. pH is 4.6 to 8. Abnormal finding, very alkaline urine. Specific gravity, 1.001 to 1.035. Abnormal finding, if it is higher, precipitation of solutes. If it's lower, polyuria. Turbidity, normally it is clear or slightly cloudy. Abnormal finding is very cloudy. Volume, normal findings 1200 to 1500 ml. If it is higher than 1500 ml, diabetes, diuretics, or increased in fluid intake. If it is lower than 1200 ml, may be kidney failure, or decreased fluid intake. Oliguria, an abnormal small amount of urine, often due to shock or kidney damage. Protein, normal findings, none. Abnormal findings, proteinuria. Protein content in urine often due to leaky or damaged glomeruli. Glucose, normal findings, none. Abnormal findings, glycosuria. Glucose in urine due to excess plasma glucose and diabetes, beyond the amount able to be reabsorbed in the proximal convoluted tubule. Ketone bodies, normal findings, none. Abnormal findings, high amounts of ketones and ketone bodies are present in the urine, most common in individuals who have diabetes. Bile and bilirubin, none. Abnormal findings, bilirubinuria. Presence of bilirubin in urine may indicate liver disease. Common cause of bilirubinuria are hepatocellular or cholestatic disease. Fat droplets, normal findings, none. Abnormal findings, lipiduria. Presence of lipids in the urine, most frequently observed in nephrotic syndrome and also been reported as a sign following fat embolism. CLO number 15. Identify the common urinary problems and causes. Urine color and odor. Normally, if you are healthy, the color should be a pale yellow to gold. There are many factors that affect urine color, including fluid balance, diet, medicines, and diseases. How dark or light the color is tells you if you are drinking enough fluid or you are dehydrated. Vitamin B supplements can turn urine bright yellow. Some medicines, blackberries, beets, rhubarb, or blood in the urine can turn urine red-brown. Urine color usually indicates problems, and this will help you seek medical assistance immediately when things are not normal. Strong urine odor doesn't always indicate problems. It may be caused by some foods such as asparagus, vitamins, and antibiotics such as penicillin. But sometimes strong or unusual smelling urine is a sign of an underlying medical problem. A sweet, fruity odor may be caused by uncontrolled diabetes. A urinary tract infection can cause a bad odor. UTI or urinary tract infection is an infection in any part of your urinary system. When you have a urinary tract infection, you may experience several urinary symptoms. UTIs are more common in women than men because the woman's urethra is shorter and comes into contact with bacteria from skin, anus, and vagina. UTI are almost always caused by bacteria, although some viruses, fungi, and parasites can infect the urinary tract as well. Kidney stones. Kidneys remove waste and fluid from your blood to make urine. Kidney stones are another urinary problem that can cause mild to severe urinary symptoms. Men ages 20 to 30 are affected most often with kidney stones, but anyone can get stones at any age. Kidney stones form when your urine contains more crystal-forming substances such as calcium, oxalate, and uric acid than the fluid in your urine can dilute.
CLO number 16. Explain the different ways of specimen collection and test. Randomly collected specimens. Specimens of choice because of potential dilution of specimens when collection occurs soon after the patient has consumed any fluids. Urinalysis. This is a test for your urine, used to detect and manage a wide range of disorders such as urinary tract infection, kidney disease, and diabetes. It also involves checking the appearance, concentration, and content of your urine. Abnormal urinalysis results may point to a disease or illness. Midstream or clean catch specimens. Strongly recommended for microbiological culture and antibiotic susceptibility testing because of reduced incidence of cellular and microbial contamination. Sterile technique. It's a collection by inserting a straight catheter into the urinary bladder to remove the sterile urine, or by obtaining collecting specimens from the port of an indwelling catheter. Timed collection specimens. Quantitative measurement of certain analytes, including those subjects for diurnal variation. Analytes commonly tested using timed collection include creatinine, urea, potassium, sodium, uric acid, and etc. First morning specimens. The specimens of choice for urinalysis and microscopic analysis, since the urine is generally more concentrated. CLO number 17. State the different method of urine testing. Kleene test. It is a self-heating method for the semi-quantitative determination of reducing substances in the urine. Acid test is a semi-quantitative test which utilize the nitroprusside and glycine to test for ketone bodies, acetoacetic acid, and acetone. Benedict's test. This test is for finding whether the sugar is reducible or non-reducible. It is both quantitative as well as qualitative. This test is used for laboratories, detection of different sugars, as well as diabetes via urine test. CLO 18. Enumerate nursing responsibilities before, during, and after urine testing. Before urine testing. Gather materials needed for the procedure. Do medical hand washing. Check the patient's name and other identification. Emphasize proper hand hygiene before and after each collection. Review client's medical history and medication. Instruct the patient to use the cotton ball or towelette to clean the urethral area thoroughly to prevent external bacteria from entering the specimens. During urine testing, explain to the client the reason of the assessment. Communicate to the client during the assessment or interact the patient to lessen its anxiety. Instruct the patient to void a small amount of urine into the toilet to rinse out the urethra. Void the midstream urine into the specimen cup and last of the stream into the toilet. After urine testing, do aftercare. Emphasize proper hand hygiene before and after each collection. Label the specimen container with the patient's identifying information. Plan for the needed intervention and document all observation.